And good morning. Welcome to Revolution Health. This is Dr. Jason Dean on a special Tuesday morning coming to you on, I guess, your drive time. Please don't watch this while you're driving, but you can listen to it later on podcast and watch it on lunchtime. So I am here with someone I'm really excited about, Dr. Jolene Brighten. First, Dr. Jolene, it's a pleasure having you on Revolution Health. Thank you for being on.
Yeah, thanks so much for having me here. It's a pleasure to get some time carved out for us to have a conversation.
Absolutely. We're talking some serious information today because anyone who hears Dr. Brighten talk today and really get into her stuff, you're going to know what's going on because you probably have an issue. We both deal with a lot of women, and her education and knowledge on women is phenomenal, and knowing why you don't feel so well. So before I dive in, let me get a little background on Dr. Brighten because she has a phenomenal background and she's being toured around the world. She's all over the place. She is a functional naturopathic medical doctor and a nutritional biochemist, and she focuses on women's endocrine health. You're actually recognized as a leading expert in the post-birth control syndrome, and you actually have a book coming out, which we'll talk about probably towards the end, which is called Beyond the Pill. So, Dr. Brighten, how did you get involved in all of this, especially niche market where you're dealing with women, especially ones who are coming off the birth control pill, because we know a little bit about that. Where did that all get started?
Yeah, the funny thing is that I swore off, birth control altogether in terms of my clinical practice. I had spent 2 years in a homeless youth clinic, which was a lot of dispensing of these pharmaceuticals. And this is a high-risk population. So having access to hormonal birth control is a really important part of managing their healthcare. So 2 years of that. And I was also, doing rotations in internal medicine clinics. And what I came to observe is that, in the state-funded homeless youth clinic, we had to give the full story about what was happening with birth control and the side effects and things to look out for. And in the general medical practice, it was, hi, you're going to college. Here's a pill. Congratulations. And that was about it. And that really struck me as odd. And, when I started my own private practice, I was so over birth control at that point that I was like, I don't want to talk about it. And my husband laughs at me because he's like, I remember the day when you were like, I'm never talking about birth control again. I'm so over it. And he's like, and now you wrote a book on it. I'm like, the universe just kind of chuckled. It was like, oh, really? You want to say never? Watch this. So, with that, how it really evolved is that I got known early in when I opened up my practice as the doctor who believed women's stories about birth control, which I found so odd. All it was just listening to what they said and honoring their story. But women would come to me, for example, after having an IUD placed, and they'd say, ever since I had this IUD placed, I feel like I'm losing my mind. Like I don't feel like I'm myself. I'm crying all the time. My doctor wants to give me all these mood altering medications. And it was something that would hear them and try to support them wherever they were in their journey. And as I attracted more and more of these patients, I came to learn that, most, if not all of women struggle to come off of hormonal birth control. I did 10 years on the pill. Super grateful that I had that tool so I could become a first generation college student and become a doctor. But when I came off of hormonal birth control, not only did I think I was the only one, but my doctor reinforced that there was something wrong with me, that hormonal birth control didn't cause any of these things. I lost my period for the first time in my life. I had cystic acne for the first time in my life. I had a lot of mood symptoms. And it was really through my patients that I came to understand that what I experienced wasn't unique. In fact, I talk to women all the time, and you can get on these chat forums. You can just ask a woman. The majority of women have some kind of birth control story. And those who try to break up with it have come to, fall into this category of what is termed post-birth control syndrome, for which, having a research background, when I started observing this trend in my patients, I started documenting it, started developing protocols with it. And that led me to author the book Beyond the Pill, where I'm sharing all of those protocols and what women should know about supporting their body on hormonal birth control, how to get solutions beyond the pill. So I know all day, every day, a woman can walk into a doctor's office and say, here is my lady problems. And they will say, well, here's your pill for that, or here's an IUD or a patch or a NuvaRing. And it's really not root cause medicine. And so I know women can get that solution. I wanted to give them solutions and alternatives to using hormonal birth control to manage their symptoms.
That makes total sense. And it's interesting because I hear you talk about women are looking for a source of hormonal birth control. And I tell people all the time, you know, I think the pharmaceutical world has gotten completely out of control, but let's not be naive to think that women aren't looking for a solution, and they're going to look for a solution of any kind. And then obviously that pill gets given to them. Now, do you go through with women on the potential side effects they may have of that, but then the long-term effects? Because I think you might agree, and you can go through a little bit of this, of unfortunately, women probably aren't educated themselves enough about what they have going into this situation. And the next thing you know, they do have this post-birth control syndrome. So do you go through that with them? Do you do work on the education process of, okay, this is what happens if you do go on it, and then this is what would happen when you do come off of it, to actually get your body working properly again?
Yeah, so this is what I do in my clinical practice, and I outlined and detailed this in my book as well, because really the way I see it is that women should be given all the information, so at the end of the day, they feel confident in the decision that they made for themselves was the best decision. And so, absolutely, if you're going to go on hormonal birth control, well, let me back up and say this. The majority of women are using hormonal birth control for symptom management. Now, this, I think, is a big disservice in women's medicine, because those symptoms are your body's way of speaking up and telling you that something else is going on. And in the case of, heavy, painful periods, sometimes women are given the pill. Sometimes it works, sometimes it doesn't. It'll take the edge off, and they find out decades later they have endometriosis. So nobody actually asked why. Same is true with polycystic ovarian syndrome, or PCOS. Women have irregular periods, or, they have acne. They're past hormonal birth control with no discussion as to what is going on. They're placed on these hormones for decades. I mean, this is the first time in history we're seeing women who have had their entire reproductive system suppressed for decades on end. I mean, I did 10 years. I have some patients who, they were put on the pill as a teenager, and they don't come off of it until their 40s. Like, that is a very long time to have your system being suppressed. And with that, when we use it for symptoms without ever asking why, we're delaying a diagnosis, which in the case of polycystic ovarian syndrome is very dangerous. The root cause of that is insulin dysregulation and inflammation. These women are at risk for heart disease, for stroke. They're at risk for diabetes, and yet their period seems regular to their doctor, so nobody's checking in on it. P.S. That's a medication-induced withdrawal bleed. That's not regulation of your period. But nobody asks these questions. And, sadly, it really isn't until women start to come off of hormonal birth control in hopes of making a baby that they are then presented with, like, well, you're actually infertile due to this condition was left to progress because we were treating symptoms and not really addressing the root cause. And by the way, that hormonal birth control also comes with the hefty side effects of insulin dysregulation, blood sugar dysregulation, increased risk of stroke and heart attack. Oh, and P.S., you were already at higher risk of that because of this condition. Like, this is why we have to have this conversation. We're not shaming women. Like, it's 100%, you're right. If you just want to mask your symptoms, you want to shut that down, 100% you're right. And I'll support you in doing that and in knowing what side effects to look out for. And so beyond the pill, I go through, here's what might be causing your period problems or your acne or the reason your doctor wants to put you on hormonal birth control. Here's what might be going on. Ask your doctor to investigate this. Here's the lab testing you should have done. And here's what to do right now, because as you and I know, natural therapies take time. So we haven't got any time to waste. So we get right into solutions right away. And then in each chapter, I outline, if you're going to stay on hormonal birth control, know this is the systems it's impacting, the symptoms you should look out for, and what you can do to safeguard your health and make that, that time you spend on hormonal birth control have less of an impact, but also the transition off be more successful. So many of us, myself included, you come off of hormonal birth control, your face explodes with acne. Your first thought is, I want to get right back on it. Like, I don't like any of this, but really those symptoms are your body's way of telling you something needs your attention now.
That totally makes sense. And it is fascinating because what you said is a lot of people will go on, and whether it's birth control or any other medication, they'll go on it because they're trying to handle something. They have a symptom they don't like, but they don't think about the things that they're not seeing yet, but then could come around in 5, 10, 20 plus years. And then they think, oh, well, I just have this other problem. No, it was actually something that was building up the whole time because you didn't know all the side effects or even the consequences
Mm-hmm.
come with what that decision was. And it's not that you weren't trying to make a knowledgeable decision. It just wasn't a fully educated decision. Now,
Mm-hmm.
going forward too, because you're dealing with this now, let's talk about the endocrine system, because I think so many women and men don't know enough about the endocrine system and the stress that's put on not only the adrenals, but the thyroid. There's so many women out there that have thyroid issues, and they're coming back with blood tests that may not even show anything. And what do you see in that world with women battling these issues? And it could be thyroid related specifically, or it could be other systems of the endocrine system. But what do you see from that aspect? Because I think there's so many confused women out there that could use some value from that.
Yeah, and this is something to understand that, one of the symptoms of hypothyroidism, which is the most common thyroid disorder that people will have in general, but it mostly affects women, one of those symptoms is irregular periods, or a period that goes missing. And so it can be a big reason that women are put on hormonal birth control. So I love that you bring this up, because sometimes women, this is what they present with, and their doctor doesn't investigate thoroughly, because all they're running is a TSH, which is thyroid stimulating hormone. It's a brain hormone that talks to your thyroid, but it's not the full picture. So we have to get lab testing, a TSH, what your brain says to your thyroid, how your thyroid responds, looking at the free T4. It makes a little bit of free T3, but mostly that conversion is happening in your other systems in your body. So like the gut, the liver, and the kidneys are primary areas where we make that conversion. But it doesn't stop there. And that's where doctors, even in the naturopathic and functional medicine world, will stop there. Or maybe they'll run a reverse T3, which is what I call the hibernation hormone. And that makes you just want to gain weight. You're cranky. You want to go to sleep. You're like a bear in winter. So hibernation time. You can look at all of those along with thyroid antibodies, and every woman should have TPO and thyroid globulin antibodies ran every single year as part of her yearly screening. Just because your antibodies are negative now doesn't mean they'll be negative in the future. But with all of that, even with that lab testing, we have to recognize that's one snapshot in time. Thyroid health is so crucial to women's health overall. There's actually an entire chapter in my book just dedicated to thyroid and adrenal health and understanding that. But with that, you can have normal looking labs. Now it depends, on the lens they're being seen through, but even through the functional optimal lab ranges, they can look normal. But what can be going on is you can have cellular resistance. So we see this in inflammatory conditions. So, inflammatory conditions like autoimmune disease, if you have infections, certainly being on hormonal birth control, which is inherently inflammatory, PCOS. And so what can happen is, your thyroid labs look normal, but you can't actually use them at the cellular level. This can also happen if you don't have adequate nutrient status. So you don't have good B vitamins and vitamin A and vitamin D and all of these key players in thyroid health. The other thing that can happen is you can be estrogen dominant and not have adequate progesterone. Now, this is another place where it's like PCOS women, by definition, that's anovulatory cycle. So if you don't ovulate, you don't make enough progesterone. Maybe your banana's stressed out. If the environment is telling your body that it's not safe, your body's going to say, let's make cortisol instead of progesterone, because we're not making babies here. We're making survival hormones. We also see it with hormonal birth control. The way the pill works, the IUDs are different. They can shut down ovulation, but the patch, the ring, the depot shot, and the pill, all of these hormonal contraceptives, they're meant to shut down ovulation. That's how we don't have a baby. Well, that means no progesterone. And that progestin, which is synthetic, okay, it's not the real deal. It doesn't work the same. And so that's another reason why women can experience hypothyroid symptoms, but all of their labs look normal. And there's sneaky ways that this can show up. So it's not always the skin is dry, hair is falling out, or, I'm feeling fatigued. It can be subtle things. Like I wake up in the morning and my throat's kind of gravelly, like my voice is changing. That's because without adequate thyroid hormone, we'll actually see that there's sugar deposits happening on the vocal cords, and that's reversible. But this happened to me before I was diagnosed with hypothyroidism, as I was like, why does it sound like I just smoked 20 packs of cigarettes like every morning? Like what happened to my voice? Having joint pain, but not the significant joint pain, like people think joint pain with hypothyroidism and they think like, oh, my shoulders, my knees, my hips. Yes. And it can also be really subtle with like your feet or your hands. So you're typing all day. These postural muscles, these tiny little muscles that are working a lot every single day, without adequate thyroid hormone, they can't be repaired. And then, as I mentioned, there's the fertility issues, the fact that your period may be irregular, you may not ovulate. And some of that is because the same mechanism that will cause TSH to go up will also cause prolactin to rise. And prolactin we think of for breastfeeding, but it'll also shut down ovulation. And so with all of this, if you're listening to this right now, you are incredibly complex. And if you have a doctor or any, natural health provider or conventional health provider who is only looking at your reproductive system or only looking at your thyroid, understand that at the end of the day, the number one person who does not care about the compartmentalization of medicine is your body. Your body doesn't care if the endocrinologist only looks at the thyroid and the gynecologist only looks at the ovaries and what they're producing in your reproductive system. And, the gastroenterologist only looks at your gut, because it's all connected. And I imagine your body just giggles about that. And it's like, wait a minute, how do you think we just keep these things all separate? No, they're all interconnected.
Yeah, thank you so much for saying that. It's so true, and there's so many people, and there's even doctors out there who are still not seeing that aspect of how it actually works. So thank you for that. And I want to ask a question because it's fascinating. We talk about all these different things in the biochemistry of the body. Now, in your opinion, how much do you think the mineral deficiencies, the food system, et cetera, has affected women in this situation?
Oh, profoundly. So here's the thing. And, anybody listening, if you've ever heard me talk before, then you've likely come across me saying the farmer is an integral part of our healthcare system, and they are very much overlooked. And I think that, I've had this conversation many times. I can get on a soapbox with this of we need to change our poor husbandry practices in the United States. My background is in nutritional biochemistry and food science. I went to an ag college. This was a conversation happening decades ago. So the way we care for our animals, a grass-fed animal definitely provides you very different nutrient profile than, the general farm-raised animal. And that animal that's raised, grass-fed, there's going to be less of them. They're actually helping with the microbiome of the earth, which has a big long-term impact on the health of every single thing living on this planet, every single thing. We are very connected to the earth. But in addition to that, the way it works in the United States is that we come in and we say, hey, you just grow corn all day, every day, and you're going to grow soy over here, and then we're going to give you money for when that doesn't sell. I think we really need to incentivize the farmer to be rotating crops because, it's in a lot of ways, I totally hear the vegan and vegetarian argument for this is what's going to help the planet. But at the same time, the way that we farm soy is decimating the microbiome of the planet and stripping and robbing it of its nutrients. And so, it's anytime we see the pendulum swing one way or the other and we get really dogmatic about things, that sure enough, that's not the solution. That is just not the solution. And really, when you look at the biodynamic farming and the way of coming in, I just love these farmers who have the chickens, the pigs, the cows, the different crops, they're all on rotation. And the nutrient profile of those vegetables, of those animals is so much more nutrient dense, than what we're seeing these days. And if we just take magnesium for an example, I always will be a food first, lifestyle first physician. But at the same time, when it comes to magnesium, it's man, you can't eat enough of magnesium-rich foods to really replenish those stores because the earth has been stripped of this. So we're at a point where we need to be taking supplements for magnesium. And why I use this as one example is there are hundreds upon hundreds of biochemical pathways that magnesium is involved in, from making your neurotransmitters and your melatonin, which is an antioxidant and helps you sleep. It protects your mitochondria and your ovaries. So it's really, really important, not just sleep, to also running liver detoxification pathways and how it's involved in metabolizing your hormones. So, to your original question, 100%, the way that our food practices have been, has really been done a big disservice to all of us on the planet, not just humans, but every single species. And it's interesting because I was actually laying in bed with my husband this morning and we were talking about, we're currently in Paris, France, and we were talking about how we haven't seen anyone overweight. We haven't seen people overweight. And we were just talking about all these different things and, what contributes to that. And I'm not somebody who jumps on board of being this country is better than this country. I think there's something to learn from every culture. And I say that because people love to be like, here's what the French do better than us. And some things they do better than us. Like, I will tell you, they do cheese a lot better than us.
They do better a lot better than us too.
Yeah. So, but with that, I'll say something that we observed is that there's not a lot of processed food. Like you have to go out of your way to get processed food here. Like we have to go to specific markets. It is a lot easier to walk out of my door. There's a produce stand. Here's a cheese, like an artisanal cheese shop. Here's the bread maker, and like here's the butcher. And you go to talk to the butcher, and they will tell you all about that animal. And I live. My home is in Portland, Oregon. So if you've ever seen that episode of Portlandia where they're like, did the chicken have friends? Yeah. We're so like that. Like we're so like that. But like I can go to the butcher, have a conversation with him. He's actually going to tell me about his family too, and like how long they've been, in this practice and doing this business. And it's just so very different to think like, why are we not observing obesity here as much? Well, you have to walk a lot. Like there's not a lot of cars. I don't even have a driver's license, here. That's not even an option for me. But it's also that like you have to kind of go out of your way for processed food. And what we've done differently in the United States is that we've made convenience food everywhere. And you have to go out of your way to find organic food and whole foods. And that is something that, I have been in health long enough to watch the shift that it was like really, really easy to come by processed food, and getting organic was difficult. Now it's so much easier. Why is that? Because of the people right now who are listening this, who dollar voted to support the farmer, to support, getting organic food and making it available. And so I say that because, well, I may be painting kind of this bleak picture of like, wow, what we've done to our food supply. Understand that where you vote with your dollar and the choices you make every day is exactly what we need to turn all of this around, which is going to benefit your health immensely. And as you start to benefit your health, I mean, that just spreads global wide so that we can start to benefit the health of the planet.
Wow. Thank you so much for that. That was so brilliantly and well said. It's phenomenal. And I think everyone really appreciates that information. And we could talk for days on this stuff because we're so in alignment on that. I want to dive in as we finish off. I want to dive into your book. So Beyond the Pill. So give us a little on this book and why people need, I know they should get it. I want you to tell them why they need this, because I truly believe there's this massive epidemic of female issues that women just don't know what's going on. I mean, I'm in America and women are tired, and guys make them tired too, but women are tired. Why do women specifically need this book?
Yeah, so this book is written for women, but I think that if you are a female ally and you are a man, then you should grab it too, because you'll understand a lot, and you'll never say like, oh, she's crazy because of her hormones. You won't make any of those jokes anymore because you'll be smarter. So, with this, I wrote this book as really a complete hormone manual. So for me, sex ed was an epic failure. It was like, here's how you put a condom on a banana, and being a woman is terrible and you have periods once a month. And like, it was like, no way really helped me understand my body. And there's so much, I started hormonal birth control because I had painful, heavy periods. And I was like, yes, sign me up for that. And then for like 2 years, I was like, I'm not even going to have a period, like whatever, I can control my body. But in retrospect, I'm like, I really wish someone would have told me, hey, that was actually due to elevated prostaglandins and estrogen dominance. And those symptoms that you were masking, they weren't being addressed. They were only and so that's why when you came off, things were so much worse. So, with this book, I really, I wrote a whole chapter, which I called the decoder ring chapter. Like the day you get your period, you should be handed this book so that you can understand and really decipher, what do your symptoms mean? Like we're told in medicine, or, we're told as women, hormones are just horrible. But the reality is that they're designed to give you superpowers when they're working optimally. And so if you are having hormonal symptoms, what does that mean and what can you do about it? And so, like I said, previously, and if you missed this, go rewind it, you guys, and listen to it again, where, I talk about in the book, here's your symptom. Here's what's going on that's, driving you to the doctor to consider, maybe birth control or maybe other things. And here's what it could be. Here's the lab testing your doctor should do. And here's what you can do right now. And so I explained to you what your hormones do, what they mean, what imbalances mean, what solutions are there. And I designed the book. So there's a quiz that happens in chapter 1. You'll take the quiz on your hormones. As soon as you figure out what's going on, we jump right to, okay, so if it's, for example, estrogen dominance, go to this chapter, you need to read this chapter, and then here's the pages with the solution. So I designed it, although you can read it front to back, but I know what it's like to have your hormones in balance. So if your hormones are out of balance, you don't have time to read a book from front to back. So you can get in, find the problem, and immediately find the solution and start working on that right away. Now, if you do decide to use hormonal birth control, there's also solutions in there for you as well. And if you've ever taken hormonal birth control at any time in your life, you definitely need this book, because if you haven't actively worked to undo what has been done by hormonal birth control, those issues are still going to exist. Things like leaky gut, disruption of the microbiome. And so there's an entire chapter on gut health, on liver health, because if your liver's not detoxifying optimally, you're going to have big hormonal issues. Hormonal birth control is known to cause a decrease, if not missing libido altogether. That comes down to your liver health. It's actually changed your liver at the genetic level. And so you've got to go in and you've got to work on that piece. You'll also get into an entire chapter dedicated to adrenal and thyroid health. That is an epidemic right now in women's health. That is the foundation of hormones. If you do not have those systems right, forget ever getting your estrogen, progesterone, or testosterone right. It just won't happen. There's an entire chapter about mood symptoms, how those relate to your hormones, hormonal birth control, and how to take back your mood so you don't struggle with anxiety, you don't struggle with depression, and you can get to the root cause of that. And if you are a woman who does want to become pregnant at any time in your life, you got to grab this book, because I talk you through what is the preconception care you should consider. If you're on hormonal birth control, even if you've never done hormonal birth control, these are the steps you need to take to optimize your health so that you optimize baby's health in the future. And then, of course, it's loaded with yummy recipes because, like I said, I'm a food is medicine doc. My background is in nutritional biochemistry. And look, if your food and lifestyle isn't dialed in, there's only so far supplements are going to take you. Supplements are like rocket fuel for healing, but you've got to have that diet and lifestyle piece. And so I take you through, here's how to eat. There's a whole 30-day meal plan. There's a bunch of yummy, yummy recipes in there, things that we've actually used in my clinical practice that I know work with patients. And you're also going to get all kinds of lifestyle and exercise and other guidance specific to your hormone imbalance and what is going on, so that you don't feel overwhelmed like you have to do all the things, but you can actually dial in of like, okay, if it's estrogen that's the issue, here's the lifestyle practices that you need to do right now. And then through this book, I'm going to help you build your own user manual so that you can understand what works best for you, because what is true for you is not true for your sister, your mother, or, your best friend. You've got to figure out what works best for you. And I guide you in doing that in this book so you can root cause your hormonal issues and hopefully never have to rely on hormonal birth control to manage those symptoms.
Absolutely beautiful. That's so well stated. I will actually put the link of the book and her website below in the comments. It's Beyond the Pill, a phenomenal book. She is creating just an amazing women's empowering movement through health, which is absolutely necessary. So thank you so much for that. Dr. Jolene Brighten, where can people find you, whether they want more information or they actually want to reach out to you and possibly get some help from you?
Yeah, so my main hub is drbrighten.com. That's DRBRIGHTEN. My last name's a little bit tricky there. So that's the main hub where you can find me. You can also find me at Dr. Jolene Brighten on Instagram. That's where I love to hang out and play, and I drop all kinds of knowledge bombs there. And then, of course, on YouTube as well, I have videos that I put out because I know we all learn different ways. Sometimes people don't want to read my giant blog posts, so we also have videos available for you as well. However it works for you to learn so that you can learn more about your body and really start to optimize your health.
Absolutely awesome. Dr. Jolene Brighten, the author of Beyond the Pill. She's making her media rounds because this thing is going to blow up because it's such great information. She's a wealth of knowledge. She has her background in nutrition, biochemistry. She's phenomenal. Post-birth control syndrome, all endocrine system disorders for women, as well as anybody working on thyroid, things like that. Please go check her out. Get the book Beyond the Pill. It is phenomenal. Dr. Brighten, thank you so much for being on Revolution Health Show today. I really appreciate your time.
Yeah, thanks so much for having me. And thank you so much for supporting women's medicine and helping create this change that we need.
Absolutely. Enjoy your time in Paris, France, and enjoy that lovely butter on all your meals and the good meat.
I love me some butter. That's how we build hormones.
Thank you so much for joining us today, Dr. Jolene. Have a wonderful day, and I wish you enormous prosperity on this and helping tons and tons of women, because it's absolutely necessary. So thank you again.
Oh, thank you.
All right. Bye today from Revolution Health. Everyone have a wonderful day. Go check out Dr. Jolene Brighten. She is an amazing woman. Thank you.